Hello, ladies and gentlemen. My name is Mail Youssef and I'm from Ukraine. Would like to present to your attention our study, Cortisol Awakening Response in Saliva in Hypertensive Children with Metabolic Syndrome. We dedicate this poster to the Honorary Doctor of Ukraine, pediatrician Vitaly Maidanik. He has made a major contribution to research on the metabolic syndrome among children in Ukraine. Metabolic syndrome is a cluster of the most dangerous risk factors for type 2 diabetes and cardiovascular disease. The mechanism of development cardiovascular disease due to stress, especially in children, are not fully understood. The hypothalamic pituitary adrenal axis is accessed through cortisol, hormone that prepares our body for the fight or flight response. There is a joke. Take a fish out of water and stress hormones will go up. Early research has shown that sleep pathology like sleep fragmentation and obstructive sleep apnea can increase risk of CVD. Therefore, we are interested to conduct a mini stress test by measuring cortisol level after sleep to determine the cause of hypertension. The aim of this work is to compare the salivary cortisol level upon awakening in children with metabolic syndrome associated with hypertension and without one. We examined 30 children with the diagnosis of metabolic syndrome according to IDF criteria. All children were measured by body mass index and 24-hour ambulatory blood pressure monitoring. Patients were classified into main group 15 children with metabolic syndrome and hypertension and comparison group 15 children with metabolic syndrome without hypertension. Sleep diagnostics were performed by Somnicheck microcardio device. In the report, we get apnea-hypopnea index, sleep fragmentation, and others. The cortisol level was determined in saliva immediately upon awakening using the immunochemical testing method. We got these results. Children with hypertension and metabolic syndrome had a higher BMI and a higher waist circle. In early studies, we determined that 59% of children with metabolic syndrome suffered from sleep apnea, because apnea-hypopnea index was greater or equal to 1. The apnea-hypopnea index and sleep fragmentation index was higher in children with hypertension. Early cortisol levels of saliva were significantly higher in group with hypertension. Increased BMI and elevated levels of early cortisol in children of the main group may indicate increased anxiety and sleep fragmentation in these children, which affects the development of hypertension. We took the stress indicator during sleep because cortisol secretion shows profound circadian rhythmicity and responsiveness to physical activity and psychological stress factors. It is important to determine this cause by comparing children without hypertension but with the same pathology. Thank you for your attention.